I'm Meghan Doyle, CEO and co-founder of Partum Health. Now, if you're here in this room at the Women's Health Tech Challenge, and we already heard a little bit about maternal health, you are probably well aware of the crisis that we have when it comes to maternal health outcomes in the US. Two specific stats that I want to draw your attention to. The first is this 80%. That is the level that the CDC has labeled as preventable when it comes to maternal deaths and morbidity outcomes. The second on the right-hand side is the long tail of complications that millions of families are experiencing every year as they go through their pregnancy and postpartum. Next slide. The reality is that these outcomes are truly a function of an outdated model of care. Today, we rely on a single OB or midwife without clear integration into the specialists that can really address many of those complications that we mentioned on the previous slide. We also have a very episodic mode of engaging without a way to really keep continuous communication with patients between their visits and while they're outside the home. And a lot of these factors are contributing to a growing shortage of OBs and midwives, as well as increasing levels of burnout. So it's clear from the current state that we truly need to take a new approach when it comes to supporting women and families. Next slide. And this is exactly what we're building here at Partum Health. Our focus is really on addressing the gaps in the maternal care experience. Areas like mental health, nutrition, birth and postpartum doula care, and lactation that today really sit outside of the primary maternity model. And we're delivering that care in a way that really works for modern families. We need to be there how, when, and where they need support. So whether that's in person, when that works best, virtual, so that we can ensure expanded access, and also wrapping that with asynchronous communication and coordination. This is the model that we believe really complements the care that most people are receiving today from their OB or midwife. Next slide. I'm excited to say that since launch and since serving our first 1,000 or so families, we've had incredible feedback from our patients. We've maintained a Net Promoter Score of 95. And I think this quote from one of our patients really captures what it is we've set out to do, which is to provide the type of care that every woman should experience when they're about to have a baby. We're also in the process of collecting both patient-reported and clinician-reported outcomes, and our preliminary data is incredibly exciting, showing that we're able, just as we've seen in many published research studies, we're able to address areas like NICU admissions, NTSV or C-section rates, birth injuries, and also the ability of parents to meet their breastfeeding goals. Next slide. This year, we're on track to generate north of 1.5 million in revenue. That is primarily coming from our direct-to-consumer model. We're live in 3 markets, Chicago, Houston, and Dallas, and providing virtual care statewide across Illinois and Texas. Patients primarily find us either through online marketing, referrals from friends and family, or from physicians. And today we're paid in a fee-for-service model. We have live contracts with Blue Cross, United, Aetna, and Cigna. As we look ahead, we're really excited about the next phase of growth. We plan to continue both our geographic expansion, and we're layering in exciting conversations with B2B partners, both health systems and payers who really want to elevate care for their maternal population. This also opens up the opportunity for us to migrate to more bundled fee and value-based payment arrangements, and excitingly also to serve a Medicaid population. That's been really accelerated by some of the expanding coverage, particularly with doula care in states like Illinois. Next slide. We've today built an incredible team of more than 100 expert providers. So behavioral health providers, for example, who are perinatal mental health certified, physical therapists who specialize in pelvic health, to really bring comprehensive care that's targeted for the pregnant population. Next slide. And we have an incredible team. I myself come from the business side of healthcare, and most importantly, I'm a mom. So it's a lot of those complications I mentioned on the first slide. And my co-founder, Matt Rogers, who's a former colleague from BCG and a twin dad, lived through these experiences as well. We really set out on a mission to change the type of care that families can expect as they start and grow. And we've been joined by incredible clinicians, and in particular, our Chief Medical Officer, Dr. Melissa Dennis, who's an OB-GYN and oversees all of our clinical care and practiced herself for 20 years. We also have an incredible group of investors and advisors who really know how to build and scale health services and health tech businesses, and they've been an incredible asset to us so far. Next slide. We would love to connect, especially with those of you who may be interested in partnering to bring this elevated approach to maternal care to your communities, or investors who may want to meet. We are planning to raise our Series A in 2025. And lastly, we'll be at the networking session, so really excited to hopefully connect with many of you then.
Meghan, before I open it up to our judges, we have a question from our keynote speaker. Esther Dyson wanted to know if you could elaborate a little bit about how you interact with doulas.
Yeah, that's a great question. So we actually have a team of doulas. I think we're north of 70 that work with us across the 3 markets that we're live in today. They are all independent contractors with us, so it's a 1099 model. And it covers full spectrum, both birth and postpartum. The other thing I'm excited to share is that we have actually launched our first doula training and certification program. We know that as coverage expands, there is also a growing need to really create and build this workforce up, both by certifying and training new doulas and also providing ways for them to continue learning. So they are truly integrated into the care that we deliver. They chart their births and access things through our EHR. So we view them, even though they're non-clinical providers, as an integral part of our care team.
Wonderful. And from our esteemed judges, a question?
Sure, happy to kick it off. Hi, Meghan. Could you talk a little bit further about, first of all, I'm really excited to see the live traction in 3 different markets. Could you tell us a little bit about how you're determining what makes an ideal market to expand into next? What are some of the considerations that go into that process?
Yeah, it's a great question. People always ask why Texas, and I think, first and foremost for us, it's about need, right? We know that there's an incredible shortage of OB-GYNs, and that shortage is increasing, particularly in states where you see more challenging legislation for reproductive care. So that was probably the biggest reason to pursue Texas. We also are building locally based care teams, but we do have to navigate the really fun state-by-state regulations that we have around a lot of our healthcare operations here in the US. And so Texas kind of met those 2 criteria of enabling us to be in a market where there is demonstrated need, a real need to really complement the care that people are getting from their OB or midwife, and also allowed us to reach several population centers within, 1 state border.
Hey, Meghan. This is great. Really excited to see your traction. One question I've had looking at companies like this in the past is the provider engagement piece. I think many people want a tool like this to integrate with their OB, maybe even the EHR at the OB. And, I take that there's obviously a difference between connecting people with lactation or doula versus doing sort of remote patient monitoring and blood pressure and things that would be maybe leveled up to a clinician on the OB side. But I'm just curious how you think about OBs in the context of growing this. Are they essential as distribution partners and sort of validation to drive adoption, or are you sort of saying that model just doesn't work, the economics are not there for us, we're just going to lean into more of the D2C and this surround care, which will stay more disconnected?
Yeah, it's a great question. I think definitely the former, in terms of the 2 options you laid out, like we view them as really essential partners. Of course, they're the ones delivering the primary care throughout somebody's pregnancy and postpartum. And we also know what a difficult job they have to try to counsel people on this enormous range of health needs in very short appointment times. So we have from the beginning done, outreach to practices to help them learn more about our services in order to, refer patients and get patients connected when needs arise. That was sort of step 1 for us. We've also built a lot of our patient experience on a really API forward platform. So the end vision is to continue to, create bridges, both in terms of relationships with the physicians, but also to be able to share patient data back and forth. I would say phase one, has been more about making smart infrastructure choices so that we're able to do that. But part of our focus right now in building these B2B partnerships is understanding, what is the appetite? And, honestly, a lot of OBs are really, really busy. And so they tell you, like, what I want to know is like the patient's getting the care they need, and you can like reach me if you need. But they're not going to be reading updates on, every meeting that somebody has with their doula, their lactation consultant, right? So I think that's definitely something we're focused on in the next phase, is finding the right level of connectivity and communication and integration with that primary maternity care provider.
Yeah, interesting. Thanks.
Wonderful. Well, thank you so much.